Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christina Armstrong.
And I'm Dr. Julie Ken.
Over the past couple dozen episodes, we've discussed health technology and how to use them in clinical care.
What we're going to be doing today is closing out this series. We might come back with more episodes in a future quarter as new topics in health and technology come up in the Defense Health Agency. But what we wanted to do today was kind of round up what we've talked about, discuss some of our favorites, and come up with some parting wisdom.
Yeah. So over the past year, we've been recording lots of great episodes about how to introduce apps, how to prescribe them, what the research is behind all these, and then how to safely use them with our patients.
Yeah, so what was your favorite episode that we've done so far?
Yeah, my absolute favorites, it's hard to pick just one. I loved the ones where we had the opportunity to interview one of the subject matter experts in health technology. So, for example, the one with Dr. Hoy, his experience in this area is just incredible. And so in his ability to see the value of health technology, not just upon return from deployment, but also during deployment, was really insightful. How about you? What was your favorite?
For me, it was the episode we did with Colonel Deidre Tahan of RARE, Walter Reed Army Institute of Research. What I loved about listening to Colonel Tahan wasn't just how she likes using mobile health in treatment, but how from a system we can use it to help our military families. I love how on some of her installations she's worked on, she would say, okay, it's moving time for a lot of families. We're going to make sure everybody knows about the big moving adventure put out by Sesame Street and the Defense Health Agency. If you work at a system level, I definitely recommend tuning into that episode. It was really inspiring.
Right. There's so much power in leadership understanding the value of all the health technologies and how can we all leverage them to help support our service members and veterans and their families. And when we get moments like that, when leadership and 06 is saying, look, I get how this, not only do I understand it, but I'm actively implementing it across the base, is really an exciting thing to happen. It's when we say, whoa, here's where we're starting to make some real change.
It's one of the phenomenal things about technology is that you can use it at the population level for sure and help many, many people at the same time.
Right. Yep. It has ripple effects. You create it, you put it out there, and then it has ripple effects for a long, long time. Yeah, the reach is far beyond what we can have as just an individual person.
Is there something you wish we could have done, a topic we didn't get to cover?
Yeah, there's so many incredible health technologies that you and I have worked with, like virtual reality and augmented reality.
Augmented reality.
Right, and telehealth and just the entire realm of big data, artificial intelligence. All of that is, we could do 10 episodes a piece on all those. And so, I would have liked to go a little bit more into that, but I'd love to hear from the audience of what is it that you would like us to cover.
I completely agree. Please email us. Let us know what you're interested in, because we're not labeling this the last episode. It's more of a roundup of what we've done so far.
Right.
And certainly as these new technologies come out, we want to review them, but also existing technology. Like you said, telehealth. There's so many amazing things going on with telehealth, telemedicine, virtual health that we want to be able to cover.
Right.
Due to security and privacy reasons, we didn't interview patients about their use of mobile health technology. In an ideal world, I sure would love to hear from folks who have benefited from using these technologies and can help providers understand what worked for them. And that's something we can consider looking into in future years as well, if that interests you. Or maybe hearing from our providers about, hey, I tried this, didn't work. Tried this, it did work, and now this is what I do in my practice. That's also a great direction we could go in the future.
Julie, what do you hope people take away from listening to this podcast?
Well, if I had to come up with my number one tip that I want to just hammer home, it is test out the technology yourself. There are lots of great apps out there. You've heard us mention things like Virtual Hopebox in every single episode practically, and it is a good app, but do not recommend it until you've tried it yourself. Kick the tires, see what works, see what you like. It's not one size fits all. Okay, 2 tips. And my second tip is that technology isn't right for every patient. As much as we like prescribing apps, we do not prescribe app for every patient. If someone seems a little hesitant, that's fine. It's just like recommending a book chapter. Some patients love reading, and that makes a lot of sense to them, and some don't. And if you really push that book chapter, you're going to be pushing away your patient.
Right. There are going to be some patients who are not interested in using health technology. And so it's just as important for us to be respectful and mindful of that.
And for treatments such as prolonged exposure, we do not recommend just use Prolonged Exposure Coach and now you're an expert in prolonged exposure. By no means. First of all, it's not a self-care app. And second of all, you still need to be trained in prolonged exposure therapy before your patient can benefit from the use of the Prolonged Exposure app with you, PE Coach.
That's right.
Christy, do you have any final words of wisdom for us?
We just really hope that this podcast has provided useful information and great tips so that you can get the most out of the health technology that's out there. And so if this podcast has been helpful to you, please share it with your friends or your colleagues, and so they can get the most out of health technology as well.
Is it ethical to sit down a colleague and force them to listen to this podcast?
I know I would do that.
Who's the judge?
Yeah, who's the judge?
Okay, maybe not. Maybe not.
Thank you all for all the time that you spent listening to this. We'd love to, like Julie said, we'd love to hear from you. What episodes did we not do that you would love for us to do? What technology is out there that maybe we're not even aware of, that we should be aware of? We'd love to know about that too. Let us know how health technology has positively impacted your life, and we'd love to share that information with others.
Terrific. Thanks so much, Christy. I've had a pleasure working on this with you. It's been one of the most fun things I've gotten to do.
Oh, thank you. I feel the same way. This is one of my favorite projects we get to work on.
Yay. Well, get in touch with us. You can join our Love Fest. We're on social media at Military Health. And of course, our email address is in the show notes.
Yeah. Thank you for sharing Next Generation Behavioral Health on social media and subscribing and rating wherever you get your podcasts.
Next Generation Behavioral Health is produced by the Defense Health Agency.